followed up with an instruction of entry for any country that had recorded more than 200 cases. I'm sure if you look at the numbers we are having now and the numbers we are mentioning, that you realize we started with a real caution. 200 and you can't come into Ghana. We were all banned. All officials were banned from traveling outside the country. Not only not to go and import, but also to ensure that we stay back and do the work. The closure of the borders, as I've been mentioned, air, sea were all done, and then introduction of the mandatory quarantine. These were all part of the intervention to prevent importation. The mandatory quarantine involved initial testing, daily monitoring of signs, etc. And then on a particular day, the minister mentioned 1,030 passengers who arrived on the 22nd and 23rd of March were quarantined in 15 hotels in this country. This was something that is unique. That's the only country that had done that. Of that, about 79 and 26, first and towards the end, all tested, about 105 of them tested positive. As part of that, intervention has been along the chain with the evacuees who had to come in. Either they were deportees or Ghanaians who wanted to come or who needed to come. We had over 8,000 of these people already brought into the country, tested and quarantined as part of the measures to prevent importation of the disease. We needed to ensure that our ports of health is very active. Currently, of the 44 entry points that is manned, Port Health is only on 22, and that's something we need to expand. Port health actions are taken at the other places where we have immigration and customs assisting us do the job. We have provided logistics and face masks, sanitizers, and contact thermometers for the port health staff across the country, and have been actually expanded port health to cover not just the health, but also the local airports. Kumasi, Tamale, Wa, they all have port health staff there as we speak now. And this was done until the KIA was opened on the 1st of September. What was the preparation for the opening of the KIA? I think there's a lot, but I can sum them up in, we had to provide operational booths for port health, 12 at the arrival and 2 at the departure. We had the installation of electronic system for the health declaration forms, workshop with airline operators and guidelines on safety, and also we had simulation exercises before the airport hosting to ensure that all these things we are going up under real circumstances, how is it going to operate, and that's what all things were done. We had to do something very, very important. See, port health originally had been established more for environmental health. We have to move from environmental to human health because of the situation we have and the subsequent pandemic that we have been having from Ebola and that thing. So this gave an opportunity to move from environmental to also human health. And based on that, about 32 additional staff have been fired. Doctors, nurses, disease control officers, and clinical psychologists are part of the port health team currently. The next slide just shows the picture of port health before the pandemic. That is just those of you who have been there, you see the screen that shows you right when the temperature is high. To the right side, that shows you that now port health with booths, thermal scanners, and digitized port health currently exists, and we hope to do that in all the other sites that are coming up. We have moved our health declaration form from paper to digital, and so that also is something that makes it, that's how we are able to move things very fast at the airport, despite the fact that we are testing. We also have developed a holding bay where people who fall sick, who are tested positive, are also held to make it more complete and not to inconvenience travelers. You can see the picture, those of you who have seen the pictures of the new labs, that the booths where the samples are taken. On the right is the new lab. This is one of the 2 labs at the airport that's allowing us to do all the things we are doing. So other surveillance activities we are doing are the completion of the electronic data form, completion of PCR results to country of origin, arrival, etc. Temperature checking is still taking place, and isolation and transfer of those who are positive to the designated facilities, and contact tracing. And what we must also remember that we are not just testing. Anytime anybody tests positive. We look at 2 Cs around you, and all those passengers are contacts, and we do well to contact everybody and follow them up until they are safe for the first 2 weeks. So to detect and contain cases, case detection was very important. How are you going to identify the cases? We developed a case definition as to what constitutes COVID. We developed a surveillance and contact tracing guidelines, training of health staff, and implementation of guidelines. We also started an enhanced contact tracing implementation strategy was developed, and also had call centers that was also giving us information on contacts, people who are sick, to allow us to respond appropriately. The regional response teams were trained and operationalized across the country in all regions, and in all the 260 districts were operationalized. SOMAX, which is an electronic database, was also scaled up nationwide. In Ghana, I can tell you that we are probably one of the very few countries that are doing e-surveillance, which means that whichever district you are, as soon as you are tested, it goes through the electronic system, and all those who need to know exactly who is positive, what's your name, what's your age, where are you, where's your geographical location, so that we can have a quick response. So the next slide shows you the SOMAX Surveillance Outbreak Response Management Analysis, and I must thank GCNet and the German government for the support they gave us in this infrastructure. We also developed other applications like the website to inform Ghanaians. We also had other applications, the COVID Connect, which was more of a treatment application, the tracker to see who has become across a positive case, and we're able to help you do that. So we have the RGIS, and so we should know exactly where all our contacts are, all our positives are, and so that we are able to trace them. And of course, the partner BIOS, which we started recently, which is going to give us a national database that if I get to the airport and I say I am negative, there's a database that can verify that I'm truly negative and not just. And that is something that we as a country have started first. If other countries join, it becomes a more and more useful system for us to use. For enhanced contact tracing, the strategy was to extend the spread of the high community in high burden regions. The partial lockdown, which was 3 weeks, has been mentioned already. Teams were resourced and deployed to test, track, and link cases to the care. In the lockdown period, in that short time, we did nearly 200,000 tests were done in the 3 weeks that we had. And multi-sectoral contact tracing involvement, national security, as we mentioned, immigration, were all part of the team that helped us do the work. Early in the month, we engaged the transport agencies, VIP, STC, and among others, that please make sure you are taking contact details of all your passengers, so that should there be any case, we are able to track them. I have a few slides, pictures on how the GIS shows you where our positives are, and it's a multidisciplinary team, immigration, health workers, others, and national security being part of the contact tracing team that got. We've always had a lot of questions about testing strategy. You are not testing enough, you are testing too much, it's delaying. The mainstay of our test was the PCR. Initially, we were testing based on case definition, so there were few. If you are sick, we test you. Then we move into testing close contacts, not all contacts. And then we move to enhanced contact tracing during the lockdown, so that all contacts are tested. We also did a perimeter screening to see where is the community spread. And we also continue on that, and only a very few of that has currently changed. That's the only perimeter has changed. The rest still remains what we are doing. The initial PCR and double exit was changed to no exit, and that allowed us free our borders, our hospitals of people who were healthy but were waiting for a second test. The RDT, evaluation of a lot of RDT has been. I know there's a lot of talk about RDT. What we are going to do is that now we've done this antigen test, which we are using at the airport, the immunofluorescent assay testing for the care, which gives us excellent sensitivity and specificity. But we plan to use RDT for seroprevalence surveys across the country to give us, are people exposed, how safe are we, and what we need for planning purposes. Currently, our testing capacity has moved from 2 centers, KCC and Noguchi at the beginning, to about 16 more. And it's going to move to about 26 in the next few months. In fact, by next week, we have 2 more labs in Kumasi and Takoradi join in that. And so if you look at the next slide, the map on the chart shows you all where our maps are, and you can see in the next slide where all the positive, all the labs are across the country. In addition to that, we have the gene expert, which is being placed specifically in specific hospitals like WA and other places, so that people who are sick can be tested quickly. For containment, facilities have been designated holding rooms, was done. District assemblies provided quarantine facilities. Self-mandatory was also implemented as a quarantine. Mandatory when condition of the quarantine has not been met, you have put you, the self-quarantine is maybe put you in mandatory quarantine. We had designated isolation centers. Currently, PCC, which are largest, have actually held about 3,000 plus since the beginning of when we have all these centers providing care and isolation for us. How did we slow down the community spread? We slowed down community spread, and all this have been mentioned, just about that by the ban on social gatherings, lockdown was part of the social distancing measures were put in place, restricting gatherings on funerals, the passage of law on mandatory wearing of masks, disinfection of public places and markets, schools, institutions, and risk communication strategies was also put out, part of way of slowing down the spread. We also had a rapid response team outside of district teams that responded actively to emergencies. And those of you who remember, you had the outbreaks in Tema, Obuase, Takwa, Asankregwa, Kumasi, Lower Menya, some schools, and for those who don't know, even some of our oil rigs, we had to quickly mobilize this aspect to quickly go and contain these conditions. We also work with our academia, including the Ghana Academy of Arts and Science, to provide model and advice for us. We also put some of our old experts and professionals to go and mentor all the regions, and 16 of them were placed in the region to do just that. We did the risk communications, had taken place a lot, and I don't too much detail, but these are some things that were done in terms of risk communication, flyers and papers were producing. We had a TV, among others, and we also had, as part of our communication, a daily situation which was shared to all. Of course, the broadcast is part of our communication, assisted a lot in cementing our risk communication. And we had a lot of stakeholder engagement, the National Council of State, Parliament, traditional rulers, regional organizations, industries, MDAs, among others, were all part of the team that we met. So these are just pictures to show. What was the case management? Preparation for providing healthcare, appropriate health management was very important. Staff training and capacity building took place. Development of case management guidelines was taking place. We moved from beds, and that's 8 and 5 at the beginning of the pandemic, to nearly 1,000 beds now as we speak. Provision of equipment, ventilators have been provided, expansion of isolation centers have been done, and inclusion of clinical psychologists also became one of the early interventions that we brought in to mitigate the effect on people. So we have done a lot on case management. Home isolation is one area we have actually currently focusing on. Next slide. If you can go to the case management slide. Yes. And so a lot of things in oxygen therapy, ventilators have all been brought in. Of course, the ambulance has also brought in to improve referral. If you look at infrastructure, I can show you a few pictures of some of the key infrastructure that have been, these are treatment centers that have been built in the Fantine area. Yeah. We have the availability of the 300 plus ambulance at the time was very, very timely. It helps able to quickly move people to the sites. And I remember one central regional director calling me, DG, I have only 5 ambulances. It's not enough for me. You can imagine where we have come from. So it came up with we're linking up schools to DHMCs and the school infirmaries became very crucial when school reopened, and that was how we were able to look at that. We worked a lot with NIA and election as a health sector to prosecute this agenda that they had to do. I think I'll leave some of the governance issues. The minister has already talked greatly about it. And one of the main infrastructure that has been is that as part of this has been the rush and the force to expand and complete our EOC building, which is the main nerve center for COVID, for any pandemic response in this country. And then the team is moving in next week, and the place is fully ready for work. We have done a lot of research on people, hydroxychloroquine, people who are, as it were, who are symptomatic. Who are they? What is it about them that they are symptomatic when others are sick? These are all things that has been done. Some of the lessons learned, I think we can do that. Improving access to testing can help us go ahead of the virus, and I believe that what has really pushed us ahead of identifying, isolating, and being able to bring the pandemic to a close, not to a close, under control very early enough. Adherence to practice has been very helpful. The nation's capacity to manage critical respiratory conditions has been expanded as a result of COVID. And the rapid mobilization and deployment of health workers has been very, very helpful. And timely availability of the 300 plus ambulances has been a major game changer for us. And some of the lessons learned, that when we started, we had asked our Deputy Director General to focus on the other things. And so we started how to manage the other cases without losing them. And in all that, I cannot tell you that as at half year, antenatal coverage had actually gone up. We have had reduced number of stillbirths. EPI coverage has reduced only slightly, but we are catching up. EPI diarrheal disease has significantly reduced from 1.1 million to about 700,000, nearly 30% reduction. And that is because we washed our hands, we did social distance. And so these are things that we must keep because they have overarching this thing for us. And we have not reported any case of cholera this year, even though cholera is endemic in Kumasi and Accra, and there's no way we will not report them. So these are some of the good things we have. We have also known that managing non-communicable diseases is very important because of what COVID has showed us. And I want to use the opportunity as I close to thank the national team, the president, the other ministers who provided the leadership and the guide and the push for us to do what we did, members of parliament, academia. Our health partners have been very supportive, both financially and technically, the media, traditionalists, and the general population. Thank you very much.
At a point, he became everybody's doctor, Dr. Patrick Kumabwaje. Let's celebrate him with a big round of applause. One of your slides I take keen note of is a slide that shows, may I say, the positive unintended impact of COVID and the interventions, a reduction in a number of other conditions, and the fact that, for example, cholera, which is endemic in Accra and Kumasi, as a result of the improved personal hygiene, we have not recorded a case of cholera in Ghana in this year, 2020. So there have been some positive parts to this enterprise. We have just about 30 minutes to wrap up. A number of things will happen in this 30 minutes. The Honorable Abena Osei-Asare will tell us about what we've been spending money on. Dr. Nsia-Asare will tell us about the next steps. And then we'll show you a little documentary before we end on some of the things that have already started as part of the next steps. My job is just to speak very briefly to some of the underpinnings in communication that we have used during this enterprise. To get an all-of-society approach, it means that the entire society must sing from the same hymn page or the same hymn book. And so what we needed to do was to create a lot of heavy public awareness from day one. What we also needed to do as part of creating public awareness was to have a high level of transparency. And so you recall that initially the media was reporting, we've heard there's one case here, we've heard there's one case here. We now had to roll out a website in collaboration with our colleagues at Risk Communications, Dr. Da Costa and his team, So now on the Ghana Health Service website, created a dedicated page where in real time they could be updating to avoid all of that misinformation and miscommunication that was coming in. We also had to now work heavily towards fighting falsehoods and quickly responding to false narratives and fake news. And I want to celebrate our colleagues in the media. You have done a yeoman's job in helping us to ensure that the right information was put out there. We cannot thank you enough, because the work that you have done as media practitioners, you didn't look at it as time for competition, time for breaking news, etc. But you looked at it as an opportunity to join in a national exercise to provide the right information to the Ghanaian public so that we could all be forewarned and forearmed. The President himself took charge Sunday evenings with his national updates, which many of us looked forward to hit some of the high notes. We, those from the village, we say, Assembly Oha is a Chiamiano, Assembly Oha is a Ohenan Kasano. And the President himself did that on Sunday nights through his fellow Ghanaian addresses, which he still does. I think he's done the 18th update, but it is part of the exercise to provide awareness and transparency. And in these days where we notice people are getting complacent, draw attention to the risks that are out there, particularly the risk of a second wave and how to deal with it. I want to also thank a number of agencies, the health workers and health-related agencies. You've done a fantastic job in helping us save as many of these 47,000 lives as have been saved so far. The security agencies that helped us also to do the initial lockdown so that we could know the dynamics of the virus. We want to thank you. And I want to also thank all of those who availed their buildings to be used as isolation centers. You remember some of them were being attacked initially, I'm sure you recall. But as time went on, we saw from the Soccer Center, JFA, the Pentecost Church, and many other places, other hospitals with high intensive care beds that made them available. I want to thank all of you. I want to show you a photo of a gentleman who refuses to make public appearances, but he has been a very, very, very key pillar in this battle. I know he will be upset that I've put his picture up, but this is the coordinator of the response program, Dr. Asamoah, who has been working in collaboration with the Office of the President and has been helping and guiding and advising to get to. I think we can give him a bigger round of applause than what we have done now. He's been key to what has happened. At this stage, we have 3 more things to do. Talk about the money, talk about the next steps, and show you how the next steps are beginning to unfold. Let me invite the Member of Parliament for Etiwa East, my sister, the Deputy Minister for Finance, the Honorable Abena Osei-Asare. Let's welcome her to the podium.
Thank you very much, Honorable Minister, and good morning, fellow Ghanaians. I would like to start from where the previous speakers have left off. I'm doing this on behalf of the Minister of Finance, who is also at the African Free Continental Trade Conference. And so let's go to slide 4, because most of the things I had in the previous slides have been mentioned. There's a question that people keep asking, that how has Ghana been able to manage the COVID-19 pandemic with such spectacular health outcomes? Forgive my voice, my voice is a bit strained from campaigning. And to answer the question how we were able to achieve such spectacular outcomes, I would first like us to look at the socio-economic impact of the COVID-19 pandemic. So we move to the next slide 5. Slide 5. We all know that precious lives have been lost in this pandemic. Livelihoods have been severely impacted negatively. Almost all the sectors of the economy were also impacted negatively by the pandemic. But as a result of the implementation of the restrictions. Even our projected GDP growth was revised from 6.8% to 0.9%. The pandemic also affected our ability to even collect revenues. As a result of that, we saw local economic activity slowing down, and spending was not going on as it was supposed to be. But on the other side, we also needed to spend to curtail the pandemic, because we had a couple of things that government needed to provide the health sector and the other sectors to help us fight the pandemic. So this saw us revising our fiscal deficit from 4.7% for this year to 11.4%. And we also had to suspend the fiscal responsibility rule, where we had a ceiling of 5% of our GDP for any fiscal year. We had to suspend that because of the additional expenditure that we incurred and the reduction in revenues as a result of the mitigation factors that we had to put in place. So, like I said, we had two things in mind: protect lives and protect livelihoods. We had to close the borders, and in closing the borders, we needed people to man these borders. And in manning the borders, they required funding. So government made funding available through the coronavirus alleviation plan. We had Plan 1 and Plan 2. The Plan 1 saw to it that as a result of the partial lockdown, we had some sectors of the economy being adversely affected negatively compared to the others. So the first thing we looked at was the household, individuals. And so government had to provide food, raw food, and then dry food, and then cooked food to some sectors of society or the economy. Government needed to provide money for this. Again, in terms of funding for tracing, testing, and treatment, the 3 T's, government needed to provide funding for that. And this was also done in the CAP plan that was sent to Parliament. Also, we heard Dr. Abuaji mention that they saw an influx of health workers. Immediately, government had to give financial clearance to enable the Ministry of Health employ about 24,000 health workers to help us mitigate this. And not just that, government also felt that the workers, the frontline health workers, needed additional boosts. So government also provided relief in the form of tax waivers and allowances for these frontline health workers. Again, we felt that we should take advantage of this pandemic to improve on our health infrastructure. So government also made available some funding in the Agenda 88, which increased to Agenda 111, where we are seeing that there's 6 new regions having new regional hospitals, and then districts that did not have health facilities also getting district health facilities, including my district, Etiwa East districts. Dr. Abuaji also mentioned that government invested in sanitation and hygienic things that has resulted in no recording of cholera this year. Yes, we have to invest in sanitation and fumigation, and this is something that government is going to do every quarter to fumigate the markets and the schools to bring down, diseases like cholera and any other thing that will help us also mitigate the effect of. And all that I have mentioned here, can we move to the next? Yes. So this is what government took to Parliament in the mid-year, that we needed to have a preparedness and response Plan 1 and Plan 2. The Plan 1 was what government, that was 1.2 billion. And this government sought through the Ghana Stabilization Fund, where we keep our oil revenues. We went to Parliament to ask Parliament to reduce the cap. In that fund, we had about $300 million US in that fund, and we asked Parliament to reduce the cap to enable us, bring it down to $100 million, to enable us use the difference. We had a little over 300 million, to enable us use the difference of a little over the 200 million to fund some of these programs. So the first one that Parliament approved for us, we got about 1.2 billion. And out of that, government also used 600 million to address the small and medium scale enterprises who had also been affected adversely by the COVID pandemic. And before we all began, we saw the CEO for National Board and Small Scale Industries attesting to the fact that over 120,000 businesses have had some support in this regard. I think government deserves an applause here. This preparedness plan 1 and plan 2 also took care of the electricity that government gave to businesses and households. As we speak, the Lifeline consumers continue to enjoy free electricity. And the businesses had, yes, for 3 businesses and other households, had 50% reduction in their electricity consumption for 3 months. That also government funded fully. The government also funded fully and is continuing to fund fully the water that we have given to businesses and households and everybody. And this started from April and is going to continue to the end of the year. And we heard Dr. Abuaji mention that we had to man our borders and everything and also help with contact tracing. So government had to fund extra funding to the national security agencies to enable them support Ministry of Health and Ghana Health Service in this regard. Again, this year we also know that we're going to have an election. We needed to, concerning the registration, it wasn't we didn't know the impact of COVID-19 prior to the 2019 budgets. So we didn't have a budget for this. Government immediately sourced for funding and was able to fund EC to buy PPEs and all the other things that they needed to enable them carry out a successful registration. And I believe that this was also achieved. Again, government also saw that most of the ministries, departments, and agencies had their internal IGF or internally generated funds coming down as a result of some of the partial lockdown activities that we implemented. So government had to support them with extra funding because something like the spraying and the fumigation of these markets, it wasn't in the budget of the MDAs that carry it out. So government had to do that. And I said it's something that government is going to do quarterly to see to it that we bring down diseases related to death and filth. And so one may ask, how was government able to secure all this funding? We still need more money, but this was how government was able to secure some of the funding that we have been able to utilize. The first one I talked about was the Ghana Stabilization Funding, through the lowering of the cap on that from 300 million to 100 million. And so we were able to transfer the excess of 200 million for us to use for the CAP 1 program. Again, we also sourced funding from the IMF. IMF made some funding available to us, provided you are able to meet the conditions. And we were able to meet the conditions. So we were able to source about $1 billion. And that is what we also used in funding all the things that I have mentioned. We also sourced funding from our business partners, our development partners, like the World Bank, AFDB, and the EU as well. And finally, we also sourced for funding from the Bank of Ghana. Bank of Ghana also gave us about 10 billion to help us meet some of our statutory funding. The statutory funding are the District Assembly Common Fund, where they disperse money to the various districts to enable them also carry out their activities at that level. The statutory funding is also to do with the National Health Insurance Scheme, where we also needed to give them money to enable them pay claims that will come to them. And also the GET Fund, the YE, and all those other businesses. We also had to source for funds to be able to meet these demands, so that at least life can still go on, government business can still run, so that we can still move the economy. So this was how we got the funding to fund some of these programs. Let me just state a few of the interventions that we were able to do in terms of the health. I mean, Dr. Abuaji has mentioned most of them, so I will move on. But we also gave funding to the health workers who were based from Accra, Tema, Kumasi, and Kaswa to their various places of work. And that also, government made provision here. Again, we also sourced for funding and made funding available to expand the capacities of more laboratories to increase the testing of COVID-19. We created isolation centers in the various regions and the districts. All of these things were funded by government. And I heard my other colleague, my Deputy Minister for Trade and Industry, also mention the PPEs. Yes, government also gave huge sums of money to be able to allow these local textiles and manufacturing companies to also provide the PPEs as well. And when we come to the households, recently, government asked that the JHS3 students, the final year students, should go back to school to enable them write their exams. This is something that is not usually done. We give for the free school feeding, it's just from the KG to the primary 6. But government had to intervene to make sure that the JHS3 students who are in school, are also fed because of some of the mitigation factors that we put in place. The sellers and markets were not able to go to the schools to sell food to them, and government, through monitoring and evaluation, realized that the students were hungry. So government provided one free hot meal for JHS3 students. The students were close to about 600,000. Thankfully, they have completed and they are gone. But the JHS2 students are also here with us, and government is still funding close to about 750,000 of these students with free meals every day. Through this funding, the national buffer stock was able to sell or buy cereals and grains from farmers to also give to the vulnerable. So it's a two-way thing. They bought from the farmers were able to get some income, and then they also help us alleviate the effects of the COVID-19 pandemic on society as well. Again, we all know that most businesses now work from home, and as we all work from home, it is data that we use. Government realized this, and in the mid-year, government, though had seen a drop in its revenue, still went ahead to give Ghanaians a reduction in the communication service tax from 9% to 5% to ease the burden on households and firms as well. In all this, for the firms, and government also in the mid-year budget made provision of about 150 million extra, apart from the 600 million that went to NBSSI, has also made an additional provision of 150 million that should go to MASLOC, the Media and Creative Arts, and the Conference of Independent Universities, to also help them mitigate the adverse effects of COVID-19 on their businesses. Again, on the firms, government has made a provision of about 2 billion guarantee facility to support the large businesses. The 600 million Ghana cedis was for the small and medium scale enterprises, but this 2 billion guarantee facilities is for the large businesses because they require huge funding, and it's in the area of the private schools, pharmaceutical companies, and businesses that are directly linked to providing things that will help us mitigate the effects of COVID-19. Government also is in partnership with the faith-based organizations and what we call the social partnership to also provide a retraining program to help workers who have lost their jobs as a result of the COVID-19 pandemic, and also to help them learn new skills. So government has made an allocation of 100 million for this. And part of it is also going to go into the establishment of a national unemployment insurance scheme that people who have lost their jobs can access. With this, we will need a legislation. So we are working on it to send it to Parliament for Parliament to approve for us. Once that is done, we'll go ahead and roll that one too out. But the funding for retraining of new skills is available, and very soon, somewhere next month, we will be launching that one too for people to access that one as well. Government also worked with Bank of Ghana to help alleviate the problems in the banking industry as a result of the COVID-19 pandemic. With this, government's BOG lowered the monetary policy rate by 150 basis points to 14.5%. They also reduced the primary reserve requirement from 10% to 8%. And this was to provide more liquidity to help the banks support businesses that were in need of funding as a result of the effects of the COVID-19. They also reduced the capital adequacy ratio, and this was for the same effect. Again, the BOG encouraged the banks to grant a 6-month moratorium of principal repayments for selected businesses, especially the businesses that were in the forefront of helping us fight the COVID-19 pandemic. Also, we reduced the interest rates through the Ghana reference rate by 200 basis points. And so interest rate per annum also dropped so that it will make it relatively cheaper for people to source for funding. Not to mention the 10 billion relief that government got from the Bank of Ghana. In terms of the Ghana Revenue Authority too, government through GRA also extended the due dates for filing of taxes from 4 months to 6 months after the end of the basis year. And the taxpayers were also encouraged to pay their taxes by bank transfers other than coming to the office. We also granted a remission of penalty on principal debts to taxpayers who redeemed their outstanding debts through GRA up to the 30th of June 2020. And we went to Parliament to ask Parliament to exempt or to give waivers for VAT on donation of stocks of equipment and goods for fighting the COVID-19 pandemic. We also waived taxes on selected 30-year pension withdrawals. If for any reason someone has been affected by the COVID-19 pandemic and the person wants to assess their 30-year pension, previously there was a tax element on it, but we went to Parliament to waive that so that to enable them go in and assess it as a result of the effects of the COVID-19 pandemic. We also had a tax exemption, or we permitted the deduction of contributions and donations towards COVID-19 to be part of your allowable expense for tax purposes. So all this that we did it to reduce the effects of, even though government was losing revenue, we did it to reduce the effects of the COVID-19 pandemic on citizens. And last but not the least, we have used this COVID-19 pandemic to come out with a transformational agenda, and that is the Ghana Cares program. And government is providing, not government, the whole of the economy, private sector and the public service. We are together providing 100 billion through the Ghana Cares program, the famous Obatapa program that was launched last week. We are providing 100 billion. The 70 billion is coming from the private sector and 30 billion coming from the public sector. We believe that we can use this to transform our economy and move our economy beyond age. So on this note, I just want to assure Ghanaians and assure everyone here that government has made funds fully available for the mitigation of these effects. And government, together with the private sector, will work to see to it that we alleviate the effects of the COVID-19 on all of us here. So on this note, I would like to call Dr. Nsiasare to come and share with us the next steps, the steps moving forward after government has secured enough funding for you to carry out your programs. Thank you very much.
Thank you very much, Honorable Minister. I'll stand on existing protocols and say good afternoon, fellow Ghanaians. I'm here just to tell you the next steps. In fact, since the pandemic started, as the Honorable Minister said, what we want to do, which the President has been saying, is to turn the crisis into opportunities. That's exactly what we are going to do, and that's the next steps. We are going to stand on the strong leadership that we have. The data and science will already be backed by data and science. And what we are going to do in data and science is that we are going to do research, gather all information, the good things that we have done, and publish it. I think we should be one of the first countries to publish this and for everybody to know what Ghana did. We also will use the all-government approach. In fact, we are going to stand on One Health approach, which is the most effective and efficient strategy to early detect and respond to any future epidemics. As you are aware, the main drivers of emergence and re-emergence of infectious diseases will continue to and even will get worse in the years to come because of population growth, because of urbanization, because of increased international travel, because of world transport and migration, because of relocation of animals and food products, because of human encroachment on wildlife habitats where the rodents are reservoirs, because of microbial evolution and development of antimicrobial resistance to antibiotics and antiviral drugs. And because we have inadequate and we are deficient in public infrastructure, that's the reason why the president has come out of Agenda 101, Agenda 111. And because we don't have also good vaccination programs, we want to also improve on our vaccination programs. Because going forward, very soon when the vaccines are in, we are preparing ourselves to receive the vaccines, and that's where the all-society approach comes in, so that risk management will also be strengthened and Ghanaians will accept it. And because of bioterrorism, where we have virulence-enhancing mechanisms of pathogens, because of this, we are going to join together with all the other ministries and make sure that we have one health approach, which was the basis of our health manifesto in 2016 that we are carrying forward. The next thing we have to do is that, as I said, all the society approach. So the risk communication is going to continue, and we'll make sure that everybody understands and we carry the people forward. The scientists, the health professionals, epidemiologists can do everything in this world, but if you don't have a leader who will lead you, the society will not follow you. That is the story of Ghana. If you realize, last Sunday the president had his 18th address, and every time he ends by saying that this shall also come to pass. And that is what we want to do. We want to also use legislation to move the country forward. As Dr. Abuaje said, we don't have any cholera for the past 3 years. So we will continue fumigating and disinfecting, as the Honorable Minister said, every 3 months, all the markets and public places, and get Ghana rid of all infections. We are going to use data and science to continuously be easing the restrictions strategically and phased approach. So if you have not released your restriction, pray that the figures continue to go down, and very soon, I know that the cinema halls are forcing that we should release it, but we are looking, we are watching. We will continuously also be testing at the airports until the time that maybe you get the treatment or vaccine. As we speak today, in fact, as at yesterday, at the airport, we have tested 33,494, and there were 98 positive cases. These are potential 98 people who have gone into society to infect 30 million Ghanaians. And as the president has always been saying, we are protecting lives and livelihoods in the midst of this crisis. So as a country, we will continue to make sure that we don't have any importation of any coronavirus into the country as we had on the 12th of March. That's exactly what we are doing. And we are the first country in the whole world where we have started doing testing, which lasts for about 30 minutes and the people get out of the airport. So we will continue to do that until the time that you also open the land borders and sea borders. Once we open it, a similar thing will happen there. We will make sure that nobody enters this country unknowingly. What we also want to do, which we are going to do, we will follow on all the social interventions, work together with the Ministry of Finance and everybody to make sure that livelihoods are also protected. On that note, what I will say is that we will continue. Our eyes are open, even though we have done very well, but we are not out of the woods yet. And as the president said, he can bring the economy back to life, but he cannot bring a dead human being to life. So this is the principle that we are basing on, and we'll continue to protect lives and livelihoods in this pandemic. On that note, I would like us all to turn our attention to a very short documentary to see some of the things that we have immediately put forward for the way forward.
Ghana's air border was closed to stop importation of the virus as part of enhanced measures to contain the spread of the COVID-19 pandemic. Despite the closure, the government had several arrangements to evacuate stranded Ghanaians who underwent a 14-day mandatory quarantine. to determine positive or negative cases to avoid community spread. However, many stranded Ghanaians who could not afford the fee for the 14-day mandatory quarantine, especially in hotels, were constantly putting pressure on government to open up the borders. Notable groups also argued that the closure of the border had restricted the movements of people, goods and services, and closed non-essential businesses. Hence, the president should listen to the plea and open up the country's airport. President Akufo-Addo on September 1, 2020, announced Ghana's decision to open up its air borders, but under strict monitoring and a testing regime.
Fellow Ghanaians, in update number 15, I announced the easing of restrictions in some areas of national life. I also indicated my hope that preparations and simulation exercises underway, including the installation of COVID-19 testing facilities at Kotoka International Airport, would give us a clear indication as to whether or not we could reopen the airport on 1st September. After weeks of thorough work, I'm satisfied that it's safe to do so. Fellow Ghanaians, I'm glad to announce that Kotoka International Airport will reopen and resume operations from Tuesday, 1st September 2020. This decision has been communicated to all international airlines.
The setting up of an installation that had the capacity to test every passenger who arrived at the Kotoka International Airport.
Ghana Airports Company contracted Frontiers Healthcare Services to provide a COVID testing at Terminal 3. We were looking for a partner or a concessionaire, a service provider, who would be highly resourced, but of course, also with people with the expertise of providing the solution that they would prescribe. And so the highly resourced entity comes from the fact that we knew we wouldn't have time, we wouldn't have a long time to deploy whatever we have to deploy. So we were looking for that highly resourced person willing to quickly mobilize, to deploy the infrastructure and the testing machines that will be needed for the service. So after combining all these three factors, Frontier came on top and we chose them.
Frontiers Healthcare Services has a rich heritage. We belong to a global group of companies with track record all over the world and delivering excellence in different areas of business. And healthcare is one of our core areas as well. So our parent company has presence in Nigeria, in other countries like the Barbados, in Zimbabwe, in healthcare. That's healthcare solutions. During this pandemic, there was a need to pivot, like almost all companies had to do. COVID changed the world completely. We had to relook at the way we do things and see how we can also get into the whole pandemic prevention side of things. And so that's how come Frontiers Healthcare Services was formed, to primarily tackle this pandemic and help control it.
The Food and Drugs Authority is mandated by Act 851 to ensure that all products that are regulated by it are registered before they can be used. So the device at the airport is classified as a medical device. And as part of registering a medical device, you have to ensure that the device is fit for the purpose that is intended to be used. So if it is trying to find out whether you have a disease or whether there's an organism present, it should be able to do that. So the Food and Drugs Authority's Laboratory Control Department or Laboratory Services Department is the one that does this, and we call it qualification. So you have to make sure that the equipment can perform, and when it is installed, it will give you exactly what it is meant to do. So as part of this, we tested this equipment. And what you do is that you just test it using the manufacturer's standards. Sometimes there's an international standard, if that is not available. And for COVID, for example, there is currently not one available. So internationally, it is accepted that you use the manufacturer's standard to test the equipment. So it's called performance qualification, that to make sure that it is performing. And this device, using our ISO accredited laboratory, and our lab is accredited, 17025 2017. So that is the process that we used. So once the equipment was brought in and put on site, we went there and we qualified the equipment. And the equipment is performing as it should. There are acceptable criteria or acceptable standards, and the equipment should be able to detect more than 99%. That is what we call it. So the acceptable criteria is greater than 99%, and this equipment actually met that criteria. So more or less for all instead of even using just the manufacturer standards, we went ahead to use samples from patients that had been done using PCR, negative and positive samples, and we also used that to qualify the equipment, and the equipment passed. So the equipment is up to standard. More or less, it was more or less 100%, but we normally accept a criteria of greater than 99%. So that is how we qualify that equipment.
We think that the antigen test that is currently being done is quite suitable because the antigen test picks up the amount of virus that is present when the person is infectious, as compared to the PCR, which will pick up any RNA that the virus has in the person. So actually, the antigen test has become a very suitable tool for public health screening because it picks up the infection at the time that the person is shedding an appreciable amount of virus, as compared to the PCR, which is very sensitive and will pick up even remnants of the virus when the person is no longer infectious. So the antigen test is actually now being seen as an appropriate tool to screen people out, people who are infectious and actually spreading the virus.
What happens is that when passengers arrive here, they have to go through the payment system. So they are directed from their tunnels right through the payment system. They go to the bank. At the bank area, it is expected of them to go through the immigration forms, either the digital or the manual. Once that is done, they are sent to the banking hall. They go through the payment. And from the banking hall, we have nice ladies who are on protocol, who direct them to whichever glass cubicle or the areas where there are samples, nasopharyngeal swabs will be taken from them. When that is done, there is a courier system where lab scientists take the sample from the place where the samples have been taken into the lab. It is a very restricted area. Windows are open, it goes in, and they receive it inside, and thereafter the processing starts. It is estimated, and rightly so, that within a span of about 20 to 30 minutes, a passenger who arrives in Ghana should have received his report from the lab, and then he receives it from the port health people and then gets away from here. That is when the person is negative. When the person happens to be positive with the test, antigen test that we're doing here, the person will be taken over by the port health authorities, will be cancelled, and then the next step will be taken. They're right here in the lab. What happens is that once samples are taken, the samples go through the COVID testing. We use immunofluorescent technology here. What happens is that it is subjected, and it is a point of care machine. It is not scratch and go. It is a point of care. It takes 12 minutes strictly. Then it produces a result. It is a point of care, and also it's a qualitative test. So it shows you whether it is negative or positive.
From the 1st of September, we eased the airport because airports were closed, all the borders were closed. Luckily, we have only one airport in the country, which is the Kotoka International Airport. So to start bringing back life to normal, allowing our citizens who are outside the country and also people who are coming to do business to come in, then we should find a system where we will not unnecessarily bring people who are potentially infected with coronavirus into the country. You are aware that even recently there's the second wave in Europe and America. So if we are not very careful, we will start what happened in March into this country. What it means is that potentially, if we are not doing these tests at the airport, we have imported people into the country, go into the community and infect the 30 million people in this country. So that is why we are doing that. And when we decided to open the airports, then we said, first, the people who are coming or the passengers coming in should be holding a PCR negative test, which has been done within the last 72 hours. We insisted that there should be a mandatory test at the airport. And if you want to do a mandatory test at the airport, it means you should have a system in place where you can do the test and get the results, and you not unnecessarily put any burden on the passenger to wait. We look at other countries who are doing it. Some people put the passengers into hotels for 24 to 48 hours and do a PCR test. And then some people also allow them to go home and self-quarantine themselves. And I've always been saying that quarantine, somebody self-quarantine needs a lot of discipline. It's like going to prison. You be in your own house, but you cannot even mingle with people who are in the house. So the most important thing that we decided on as a task force is that let's get a test which can be done and done quickly at the airport, and then people can go home. So that they don't go when we ease up and allow people to come in of chartered flights. They were quarantined in hotels for 14 days. Even the hotel, the least costs about $50. It means you'll be paying about $700 and you'll still be quarantined. So this is the reason why we got a test, which is you can do it quickly. Within a matter of 30 minutes, the results is down when you reach Port Health. We strengthen Port Health at the same time and make sure that nobody goes away who is positive.
I think our role is key. And the first thing I'll say is that we have come to augment the efforts of the Ghana Health Service, the Port Health Services, Ghana Airports Company Limited, in bringing an interruption to this infection. You have to look at the whole, put this into perspective. There's a global problem. There was this pandemic going around countries and everybody was trying to find out ways of containing it. It affected businesses, it affected lives, and there was a lockdown. During the lockdown, if people had to come in, they had to be special flights, they had to be quarantined for 2 weeks in a hotel. And I actually experienced that with my family, 2 weeks in a hotel. That cost so much money. So we thought, well, we could come into this space and provide something that would bring interruption of infection and allow people to still affordably come and be connected to family, allow businesses to run, allow international travel to continue. That's what the government wanted to do. And we thought we could come in there with our expertise and support. So our impact, I would say, number one, would be interruption of infection. It takes just one very virulent strain into the country to cause havoc. We've seen that in India, we've seen that in Spain, we've seen that in Brazil, in the US, and other places. It takes just one. And since we came into operation, we are happy to say that we have been able to identify several cases who have been isolated and kept from spreading the infection in our communities. So that's our key role, our key value we bring in interruption of infection and protecting the Ghanaian populace. But apart from that, we have created jobs for lots of people. Frontiers Healthcare Services is young, but have already employed about 350 young Ghanaians. Out of this number, 250 are in full-time employment, and then we have 100 who are, as we call our reserves. They come on local basis because it depends on the numbers. We need more hands. And so these are full-time jobs created in a time when many people have lost their jobs. So it's, I think, a huge achievement, and we are proud of that. But quite apart from that, our supply chain involves lots of SMEs who have gotten jobs in supplying us PPEs, all the masks we use, the gloves, the goggles, and all the supplies are reagents, paper, all these things is business for Ghanaian SMEs. So that's another value we bring on board.
As part of our role as a service, all COVID testing is an integral part of the work that we do. It's part of our testing and tracing and treatment. And so all tests, whether it's at the airport, whether it's in our labs, is part of the work we do. We provide oversight on how the tests are done. We've been part of the establishment of the system and making sure we give us results that are reliable. And we are also receiving the results and interpreting and following up with patients or passengers who tend to be positive or negative with the information that they need.
Pretty much the testing was very smooth. I really never had any difficulties. Everything was so, strategic. Like it was placed on point. We ushered again to the place where the sample was taken and the test ran, and it was done, and I just got my result and it was negative. So I'm pretty much happy about that. This is way better than being like stayed in the hotel for 14 days.
From one end, they checked my name with my passport. I got to the nurses. They took the sample. As soon as I came down, within 10 minutes, like after I got my luggage, I came down, and then bam, the report was out. So I did not spend even more than 30 minutes, like how people were saying.
I felt that the process was very transparent. I looked it up on the website, what the process was, and it was very good to know what the next steps are and what to prepare. And I also thought that the personnel who was here was very nice and welcoming and guided me through the process step by step. So I think this was a very nice feeling. And it's also nice to feel safe after the corona test.
So, fellow Ghanaians, this is a success story. So we've all seen it. Now the people behind the testing are not ghosts. They are human beings. They've created 50 jobs and 100 standby people, all Ghanaians. I think the only foreigners among them are 2. So this is the story, and I want you to take it along that now you've seen the lab. It's not just an ordinary test that you can do in your bathhouse or your bedroom. This goes through machine. It's a whole laboratory. There are 2 of them at each wing of the airport. And I'm happy to say that we are pace setters in this industry. Before I conclude, ladies and gentlemen, before I conclude, I will say that attention is going to be on non-communicable diseases, because if you realize that about 80% of people who unfortunately lost their lives were hypertensive, diabetics, or combination on other illnesses. That's put, as I said, 111 hospitals fully equipped. We are also going to make sure that health promotion and health prevention is part of our national health insurance scheme, so that people will know their status of diabetes and hypertension early enough, or if you're a woman, your breast and your cervix. If you are a man above 50, like us, your prostate. So all these things will be checked. And I have christened it adult way. You don't have to be sick before you go to hospital. So adults can also queue up, and then the children will queue up and go for a way. And do that we are strengthening our health system. What is that? Healthcare activities are free to the patient. Since 2016, we've strengthened national health insurance to extend. We have even piloted with family planning in about 20 facilities. And family planning is national health insurance package. I've also done assurance. If you can add other disease on it until 20. The burden on national health insurance, those who are sick and going to hospital. Diabetics may not take any drugs at all because dietitian, nutrition, the medicine are the most expensive. You see this early enough and then manage it. And this is what government is going to do to bring down impact, have a strong impact on the community. Sure. And that note, I'll end by saying we will continue and this into
of assurance that they will be excited. At this moment, to give us a musical interlude.
Atlas. The other Yamiasa Pempenswa, what the Abedrio.